If you're not sure how to approach the CCS cases of the USMLE Step 3 exam, this is the video for you. Hey friends, in this video I partnered with UWorld to show you two of their CCS cases. So I'll be going on their platform. I will show you how to approach and solve two CCS cases from their question bank, order diagnostics, imaging, treatment options, monitoring, and show you how the software will react throughout the case. My name is Malki Assad. I'm currently a plastic surgery research fellow and I will be starting my plastic surgery residency mid-June. I started this YouTube channel last year in April of 2020, and the goal of this channel is to help future applicants learn more about the USMLE journey, residency match experiences, and research. So make sure to subscribe to the channel and hit the bell sign so you get notified whenever I post future videos on my YouTube channel. I recently went through the preparation process for the Step 3 exam and I found a gap in the information available regarding the CCS cases of the Step 3 exam. That's why I made two YouTube videos, one about the CCS cases and one about Step 3 experience, a detailed blog post on the USMLE Step 3 materials and how to best prepare for the exam, and I recently created a detailed course on the CCS cases of the Step 3 exam. And you can find the links for these materials in the description below and in the cards above. One surprise in this video is that UWorld agreed to give one of you guys subscription to their question bank, the MCQ questions and the CCS cases for 3 months. This subscription is worth $400 and one of you guys will get it for free. And I will also be giving the winner of this contest free access to my Step 3 CCS course. Stick to the end of this video to know the details on how to enter this contest. I just want to say that UWorld did not pay me to make this video. I used their platform and I found it helpful. That's why I'm making this video to help you guys. Now let's start with the CCS cases. I want to start with a quick introduction about the UWorld platform. As you can see here, there is the overview, practice cases and interactive cases. Interactive cases are the ones that are similar to the exam, but you have here 41 practice cases which are written explanation of how the case could go. Let me show you one example. So you can see here the location, vital signs, history of presenting illness. So it's a written case and you can get an idea of how to approach certain cases, the management, and this is followed by the discussion at the end of the medical knowledge behind the management of this case. Some students don't feel the need to do the practice cases. My recommendation is to go quickly over them. If you're familiar with the pathology of the disease, each case will not take over 5 to 10 minutes, so they won't take much time and they can add to your knowledge about different cases that you might encounter on your exam. On the other side, the interactive cases are the ones that are similar to the exam. As you can see here, there are 51 interactive cases. Today I'll show you the management of 2, but once you get your subscription to the question bank, you can go through the 51 cases. For each case, there is this button called Launch, in which you will be presented with the exam platform, and the explanation in which you will be presented with the information how to solve the case. It's a written explanation on how to manage the case. If you're using the UWorld question bank for your Step 3 preparation, my recommendation is start with the MCQ questions. At least finish a portion of these, and whenever you're approaching the CCS cases, start with the Launch. So start by solving the case and then go and see if your management was correct by reading the explanation. I'm gonna start by showing you the platform of the CCS cases and then we will go over the management of 2 cases. So after you click Launch, you'll be presented with the case introduction. If you click OK, you'll be presented with the vital signs and then with the initial history, which has several parts of information related to this case. After you click OK, you will have 4 main tabs. The first one is the interval history and physical exam. If you click on this tab, you'll see that you have 2 main options, the interval follow-up and the different parts of the physical examination. The physical examination, you can click certain boxes. As you will see in the explanation, there are some cases that you don't need to order every part of the physical exam, while other cases you can order everything. So they give you the options to click certain parts of the exam or click all the boxes if you wanted to do a complete physical exam. The interval follow-up, this is something you usually order when the patient is admitted to the hospital and you want to check on their progress to see if there are any updates, or if the patient presented to the office and then was sent home and came back for a follow-up, you can order the interval follow-up. The second tab is the orders tab. So if you click on this, you'll see at the bottom here the order, and from here you can order the diagnostics, imaging, labs, treatment options. So this is the tab that you will be making all your orders from. If you want to see orders that you already made, you can go here under progress note, vital signs, labs, imaging, treatment records. So here, everything that you already ordered will be presented here. So for example, if you wanted to see the initial history that the patient presented with, we can go to the progress notes and click on initial history and you'll be presented with this. Now let's talk about timing. For this exam, there are two main types of timing that you need to understand. The first is called the elapsed real time, which is the actual time. For example, now I've been talking for around 2 minutes and you can see here the elapsed real time is 2 minutes. On the other hand, the simulated time is still 0. Why the simulated time is still 0? Because although the case has been open for 3 minutes now, we have not advanced the clock. We have not ordered any physical exam or diagnostics that would advance the case in simulated time. And I'll explain that more once we start with our case. Here you can see the clock. There are multiple options to advance the clock. You can either click on, which will advance the clock to a specific day, specific hour, specific minute. In, which means I want to see the patient in 15 minutes after, half an hour after, a day. With the next available result, which means you advance the clock to the next available result. For example, if you ordered an ECG now and the result will show up in half an hour and click on next available result, it will advance the clock for half an hour. And the call me when needed. So whenever something happens or an update is there, you get notified. Now let's go to the locations. So current location is the office, and you can see here there is the home, emergency department, intensive care unit, and inpatient. Patients generally present to the office or emergency department. If the patient is in the office, you can either send them home if there is nothing that requires admission, or send them to the emergency department if this is something urgent, or admit them to the hospital. If the patient is in the emergency department, you can either admit them to the hospital, ICU, or inpatient, or discharge them home based on the case. Now let's go ahead and start with the management of the two CCS cases. The first screen that will be presented with is the case introduction. The patient is 24-year-old Asian female, presented to the office with nausea and vomiting. She's well nourished and in no apparent distress. So when you read the case introduction, start thinking about the differential, the acuity of the case. Does this case require transfer to the emergency department, or this is something that can be managed outpatient? Start formulating this plan, and then you'll be presented with more information that can help you narrow your differential. And now the initial vital signs. We can look at the blood pressure here. It's normal. The BMI is normal. No fever. The pulse is within normal range, and the same for the respiratory rate. Now moving on to the initial history. You'll be presented with the reason of the visit, which is nausea and vomiting in this case, the history of presenting illness, past medical, family, social, review of systems. Let's start with reading the history of the presenting illness. The patient is 24, Asian female, presenting with complaints of nausea and vomiting, which is information that we already know for now, for several days. The duration of the symptoms is important when formulating your differential. She feels more nauseated in the morning and complains of breast pain. So breast pain with nausea, several days, patient is 24-year-old. We start thinking about pregnancy as a potential differential for this case. Her last menstrual period was 7 weeks ago, so this even raises the suspicion for pregnancy as the potential etiology of this patient presentation. Prior to that, her menstrual periods had always been regular with 28-29 days cycle. She's sexually active, monogamous relationship, never been pregnant. There is no history of sexually transmitted diseases and has never been tested. The patient immigrated to the US 5 years ago, does not recall any immunization history. Recently, she has been experiencing constipation. Her bowel and bladder function are normal. The patient denies any fever, pain, or vaginal discharge. We go to the past medical history, everything normal. The family history, there is a history of breast cancer in the maternal grandmother. For the social history, the patient has been married for 8 months, no children. She's been smoking 1 pack of cigarette per day. This is important for patient counseling. Whenever you finish the case, you start counseling the patient about smoking, alcohol, other medications. So always keep an eye on the social history for the counseling. The patient doesn't drink alcohol or use recreational drugs. and nothing abnormal on the rest of the history. So after you read the case introduction, the vital signs, and the initial history, you should start thinking about the management plan. After you finish reading these 3 screens, you should decide whether this case requires emergency orders or not. Since this patient is in no apparent distress, only nausea and vomiting, this case does not require emergency orders. So therefore we move on to our physical exam, and we have to decide whether we need a full physical exam or a focused physical exam. Since the patient is not in pain or distress, we can go ahead and order a full physical exam. So you just click all these boxes here. And click OK. And this will give you the amount of time that this examination will take. So you'll notice that it takes 15 minutes. That's why it's not wise to spend 15 minutes to do the full physical examination if the patient is suffering from pain, distress, and there are certain portions of the exam that might not help the case. So this will take 15 minutes. If we click on OK, you'll be presented with the findings of the physical exam. You'll see the general appearance, well developed, no apparent distress, skin normal, breast, there is mild breast tenderness, which is a sign of pregnancy, normal lymph nodes, normal head and neck examination, normal chest, heart, and abdominal examination. On the genital exam, you'll notice that there is bluish discoloration of the vulva and vagina with no vaginal or cervical discharge. This could be a sign of pregnancy, and this goes along with the other signs in this case that is suspecting pregnancy as the cause of the patient nausea and vomiting. The uterus is globular and soft with no adnexal masses or tenderness. Normal rectal, spine extremity, and neural exam. Let's click OK. Now, since pregnancy is high on the differential for our case, we should start making some orders that can confirm the diagnosis and exclude other diagnoses. So we go to the order tab and click on order here and type here beta HCG to confirm pregnancy. We can also order CBC, BMP as part of the initial orders. So click on confirm orders and you can choose beta HCG qualitative, quantitative, and urine qualitative. We can go ahead and order the beta HCG urine qualitative. Click on confirm orders. You can order this as stat, which means now I want the results now. CBC differential, you can also order this as stat. BMP, stat. Stat routine will not show on the exam. This is only in the UWorld platform, but routine means that you're not rushing the results. Stat means that you want the results now. So let's click on OK. You can see here that real time has elapsed by 11 minutes, which means we've been discussing this case for 11 minutes, and we have for this case 18 minutes to finish the case, while the elapsed simulated time is only 15 minutes, and 15 minutes because we advanced the clock to do the physical examination, which took 15 minutes. So now we can go to the clock and advance it to the next available result to see the results of these diagnostics we ordered. So the beta HCG is positive, which means that the patient is pregnant, and pregnancy is the likely cause of this patient's symptoms. The patient is still in the office. The patient was not sent home. Since beta HCG is positive and the patient is pregnant, we have to put some orders as part of the prenatal diagnostics for every pregnant patient. We already ordered CBC and BMP and we're waiting on the results for these, but now we can go ahead and put the rest of the prenatal orders. These include blood type and RH factor. Sometimes you just type the beginning of the word and the software recognize it and give you the additional part to save time. Also atypical antibody titer, HIV, chlamydia. We also want to screen for syphilis, so we order RPR, hepatitis B, antibodies for rubella and varicella, so we order rubella antibodies, and the same for varicella, chlamydia, urine analysis in which you can just type UA, urine culture, to screen for bacteriuria, pap smear. And it's very important to order transvaginal ultrasound to confirm the diagnosis of pregnancy. And now we can order prenatal vitamins, folic acid, iron. So prenatal vitamins, iron, folic acid, and consult the patient regarding smoking, so no smoking and no alcohol since the patient is pregnant. And you can order consult pregnancy as well. So you'll notice that I put all the orders together, which means that they will be ordered at the same time. The results will come at different times, but they will all be registered in the system that they were put at the same time. So this time that we took to put the orders in will not count towards the simulated time, it will count towards the elapsed real time. So now let's go ahead and confirm the orders. Here you can order blood type and cross match, blood type and RH factor, or blood type and screen. We'll order these two. Confirm orders. You can order these as routine because we will send the patient home for till we get the results of these tests. So routine. Atypical antibodies comes in direct. So also routine. For the chlamydia, you get multiple options. You can pick the chlamydia DNA cervix. Confirm orders routine. For HIV, we can order the ELISA. Routine. For RPR, we only have one option, so also routine. For hepatitis, we can order the antigen and the antibodies. Routine. For rubella, we can order serology. Routine. For the varicella, we order the antibodies in the serum. Pap smear. Routine. Urine analysis. Routine. Urine culture, also routine. Transvaginal ultrasound. Prenatal vitamins. Iron, we can go ahead and order the iron sulfate. Oral. Folic acid, we order the therapy because here we're not asking about the levels in the serum. If we wanted the levels in the serum, we would order this one. But since we want to give the patient folic acid, we order folic acid therapy. And oral here. So sometimes you get multiple routes of administration and you have to pick the right one. So for this case, it's going to be oral. Counsel the patients regarding no smoking, no alcohol. Whenever you click counsel, you'll be presented with a long list. So you want to go ahead and look for the pregnancy one. So here is counsel patient pregnancy, confirm orders. And after we put all the orders in, you'll see that the order time is the same for all, which is day 1, 10:20. But the report time will be different. So this is the report time, this is the order time. Since we put all the orders in, there is nothing we can do now at this point for the patient. We can send the patient home. How can we do that? We go to the location tab, we click on home and change location. That will prompt scheduling an appointment. And in order to schedule an appointment, you go to the calendar here and click whenever you would like to see the patient again. For this case, we can see the patient in 2 or 3 weeks. So let's click on 3 weeks and click OK and confirm move. And now I'll start showing you the results of the tests you ordered until the patient comes back for the visit. So the patient was counseled about smoking. This screen is asking you whether you would like to continue with the case or stop now and do something based on the results you just received. We would like to continue. The patient was advised about alcohol. Also continue. Advised about prenatal care. Here are the results of the CBC with differential. You'll see here the normal values. Here you can see the results of the patient and nothing is abnormal. There usually is a star next to where there is something abnormal. The text will be different because you have to read it. They don't usually show you a star next to the abnormal results on the text. Continue. Here is the BMP. The ultrasound, intrauterine pregnancy at 7 weeks gestation. So now we confirmed pregnancy, we confirmed that it's intrauterine and that the gestational age is 7 weeks. Continue. The type and RH factor, it's B positive, and this is important when the patient had negative RH and there is episodes of bleeding or at time of pregnancy to give anti-D. So let's go ahead and click OK, continue. Here is the type and screen, negative, negative. The antiglobulin indirect blood is also negative. So this is the same as the one that we just saw. Sometimes if you order 2 tests and some portions of the test are similar, they show you both. So there is no harm in that. Continue. Here is the urine analysis. So for example here, if there is something positive, you have to read because they don't usually put a star next to the abnormal results. The RPR is negative. The HIV is also negative. Rubella antibodies are positive. The pap smear normal. Urine culture no bacterial growth. The patient continues to have nausea upon awakening, but the frequency of vomiting has decreased. If the patient's symptoms of nausea and vomiting are severe, you might consider giving the patient something like Zofran or Phenergan, but since the patient's symptoms are mild and they decreased now, you don't have to make these orders at this point. So you click OK, continue. Hepatitis B antigen is negative. The antibodies are also negative. Chlamydia is negative. The patient has antibodies against varicella. And you can see here the patient update is saying that the patient feels less nauseated and she's no longer vomiting. Another patient update on day 8. The patient feels less nauseated, vomiting and constipation have stopped. She feels more energetic and naps less often. So this is a sign that the patient is improving and our management is successful. And now the case ended. You can see here that the case is 18 minutes and we have 2 minutes at the end of the case to put the case and orders, and only 15 minutes have elapsed, so we still have time. But sometimes the case ends even before you finish your full 18 minutes if the required steps to solve the case have been met. That doesn't mean that you solved the case correctly, it just means that you reach the stage beyond which the case will end. So you can use these 2 minutes to put orders that you forgot or something that is needed but you didn't have the time to do during the 18 minutes. But for our case, we put all the orders in and there is nothing for us to add at this point. So you can just click on cancel and exit case. The UWorld platform asks you to put the primary diagnosis for this case, but you will not be presented with this screen in the real exam. So for this one, it's gonna be pregnancy. I want to show you the explanation for this case that we just did. So if you click on explanation, you'll have the clock management, scoring and approach. I recommend having a look at the clock management and scoring to have a look of how the case should be ideally solved. But just to let you know, there is no one single way of solving these cases. There are many approaches and all of them could be correct, but this is one of them. So if you go to the clock management, you'll see the different orders that you should put for this case, including treatment, diagnostics, monitoring. If you go to the scoring, it will divide it into 3 columns. The optimal one, which are things you have to order. The neutral ones, which are things if you order them or not, it's not going to affect your score. And the suboptimal one, which are things that you should not order because they are harmful to the patient and they don't help in the diagnosis. And these are divided into physical exam, diagnostic testing, therapy, monitoring, location and timing. So this is not the order in which you should put the orders in. If you want to see the order in which you put your diagnostics, treatment options and monitoring, this is the clock management is the one. This is the way I solved the case. But if you want to have a look at the scoring and how things would be assessed, you should look at the scoring. The approach, if you have a good background about the clinical case, you don't have to read the whole thing to save time. But if you don't, you can read it to have a better idea of the clinical management of the case. But this is the part that you can skip if you're familiar with the, for example, diagnosis of pregnancy in this case. Now let's move on to our next CCS case, and we will pick an oncology case. It's case 29 here, and we'll click on launch. Case introduction, the patient is 55, Caucasian, office, complaining of extreme fatigue and anorexia. The patient is in no apparent distress, so fatigue with nothing urgent. If we click OK and advance, we see the initial vital signs. Everything looks normal here, temperature, pulse, blood pressure and BMI. And we go to the initial history. The patient is 55-year-old, presenting to the office with progressive generalized weakness and loss of appetite over the past few weeks. So we can see that the patient is suffering from fatigue, loss of appetite for something that's been going on for few weeks. It's not something that happened over the last few days. He feels that he doesn't have the energy to carry out his routine activities. So start thinking of what could be the cause of this patient's symptoms. He lost weight, experiencing intermittent night sweats. He has no similar symptoms in the past. He denies these symptoms. He has no feelings of guilt, suicidal thoughts, or lack of interest. The patient has been smoking and he drinks alcohol on weekends. He doesn't use street drugs. So from reading this initial history, we can think of cancer as a potential diagnosis, infectious causes, autoimmune, depression, but since the patient doesn't have suicidal thoughts, guilt, lack of interest, probably depression is not high on the differential. The patient is smoking, losing weight, fatigue, cancer is probably the highest on differential for this case. If we go to the past medical history, nothing. For the family history, the mother died of stroke, the father is alive with diabetes and hypertension, the grandmother died of colon cancer. The patient is married. For personal habit, the patient has been smoking 15 to 20 cigarettes per day for the last 25 years. As we mentioned above, alcohol on weekends, no drugs. This is the occupation, the recreation activities, and the review of system. It shows weakness. The patient never had a colonoscopy, and the patient is sexually active. Since the patient is not suffering from severe distress or something that is life-threatening, we don't have to do emergency orders, so we go to the physical exam. Again, since the patient doesn't have pain or severe respiratory distress, we can go ahead and order a full physical exam rather than a focused physical exam. So we just go and check these boxes here for all the physical examination parts, and we click on OK. They will tell us that the physical exam will take 15 minutes. We click OK, and we go and look at the physical examination findings. The general appearance is well developed. Skin, there is pallor, so probably anemia. The breast is normal, lymph nodes normal. The head and neck exam, it shows conjunctival pallor, while the rest of the head and neck examination is normal. Also, the chest, lung examination is normal. No abnormalities on the heart exam, abdominal exam, genital exam. The rectal exam does not show occult blood, and this is important because colon cancer could be one of the causes of this patient's symptoms. For the extremities, spine, nothing abnormal, and the neurologic exam is also normal. In the exam for the 20-minute cases, you would have the time to read the details of these physical examination findings. While the 10-minute cases, you only have 8 minutes to solve the case and the 2 minutes for the end case orders. So in this case, try to screen the information so you don't miss any orders. But for the 10-minute cases, the time is more limited. You only have 8 minutes to solve the case and 2 minutes for the end case orders. Therefore, try to be faster. Try to read the findings very quickly or screen them so you don't miss any of the important orders during the case. So let's go ahead now and start with our orders. Since the patient is suffering from fatigue, weakness, loss of appetite, we have to order diagnostics to confirm our diagnosis and exclude other potential diagnoses. So we can start with CBC, BMP, liver function test. Liver could be the reason of this patient fatigue, TSH, it could be a thyroid problem, urine analysis to see if there is any blood in the urine, fecal occult blood test to see if there is any blood in the stool. We also want to test the levels of iron and ferritin. And we start by clicking confirm orders. See CBC with differential. For this case, we can order it routine. BMP the same. Liver function test the same. TSH serum. Urine analysis. Fecal occult blood test. Here iron, we want to test the levels in the serum. We don't want to offer treatment at this point. So we go ahead and order iron and total iron binding capacity serum and ferritin. Since the patient is not in acute distress, we can send the patient home and schedule a follow-up in 1 or 2 weeks. And while the patient is at home, we can review the results of these tests. If there is anything on these tests that require the patient to come back to the hospital, we can bring the patient back to the emergency department or the office. But for now, since the case seems more chronic, we can order a follow-up in a week, and meanwhile we can look at the results of these diagnostics we ordered. So let's schedule the follow-up in 1 week, click on OK, confirm move, and now we start seeing the results of these diagnostics we ordered. So there is no occult blood in the stool, none detected. Okay, continue. The BMP is normal. The liver function tests are normal. The CBC, we can see some stars here for the erythrocytes, for the hematocrit. The MCV is normal, so this is probably normocytic anemia. The hemoglobin is also low, so this is probably normocytic anemia. And you can see here normocytic, normochromic, nothing abnormal. Continue. For the urine analysis, we start from here, everything negative. So far, we can see that blood, urine, positive. So there is blood per urine. So the most likely cause of this patient fatigue is from the urinary tract. The rest of the urine analysis is normal. Click on continue. You can see here that the iron levels and the iron binding capacity is low. And ferritin levels here are high, which could be an inflammatory response. Okay, continue. Here we get the TSH, it's normal. Continue. The patient has arrived for the appointment. So now the patient is back to the office. You can see here the location is office. We can order interval follow-up and specific parts of the physical exam. For example, here we can order general, lymph nodes, head and neck, chest, heart, abdomen, and genitalia. You can click OK and advance, and you can see that patient is still suffering from fatigue, anorexia, night sweats, and nothing has changed from the last physical examination. From the information we have so far, we know that the patient is suffering from normocytic anemia. There is blood in the urine. There are red blood cells in the urine. So we want to investigate the reason why there is blood in the urine. And we can do that by ordering a CT scan abdomen and cystoscopy. So we go to the order tabs, click on order, and here we can type CT scan abdomen and cystoscopy. Click on confirm orders, and you'll see CT scan abdomen, routine, the same for cystoscopy. The cystoscopy require urology consult, so you can order urology consult, and here you type the reason for this consultation. You can type something like suspicion for kidney cancer, suspicion for bladder cancer, or red blood cells per urine. Suspicion for cancer, and click OK. So now again you can send the patient home and order a follow-up in a week or so. So schedule an appointment. We click on appointment in 1 week. OK, confirm move. And now we got the results of the CT scan. It shows right renal cancer, suspicion for renal cell carcinoma. Click OK, continue. The urology consult, they don't have explicit management recommendation. Please continue. Click OK. And here are the cystoscopy results. Here it says that the patient declined the cystoscopy. Since the CT scan showed renal cell carcinoma, this is probably the cause of the patient red blood cells per urine. So we can click OK, and we'll see the patient in office now. The patient has arrived for the appointment. We can do the same strategy. We go to the interval history and order that with focused physical exam. Click OK. You'll see that nothing has changed from last time. And now since the patient is having renal cancer, now since the CT scan showed renal cell carcinoma, this requires surgical treatment. So what we do is we change the location to inpatient. So we admit the patient to the hospital and we start the pre-surgical orders. First we keep the patient MPO, we order IV access, we order a normal saline, blood type, PT, INR, PTT. Since the patient has a renal cancer, we want to know the stage because that will change the management. So we order chest CT scan or chest X-ray, and we consult the patient regarding cancer diagnosis. Whenever we admit the patient to the hospital, we need to take care of diet. So we either order MPO or normal diet, and in this case we ordered MPO. So the patient either ambulates at will or has bed rest. Bed rest could be complete or with bathroom privileges. In this case, we'll order bed rest with bathroom privileges. And here we can start confirming the orders: MPO, IV access, intravenous, normal saline, the intravenous, blood type and cross match. Here we can order stat, PT, INR, also stat, because we might go to surgery soon, PT, also stat, PTT, also stat. The chest CT scan, you can also order that as stat. So the counseling, we need to look for the cancer diagnosis. It's here. So cancer diagnosis. This could be routine. The bed rest with bathroom privileges, confirm. So now we want to advance the clock to know the results of the CT scan, and based on that we will order surgery consult and oncology consult to see what the next step could be. So let's go to the clock and click on with the next available result. Okay. Since the patient is in the hospital, the software gives us updates about their vital signs based on if they're in inpatient or ICU. Okay. Let's go and click with the next available result. The patient consulted about cancer diagnosis. So if another option, instead of clicking with next available result every time, you can just look when is the CT scan report time, and we can advance the clock to that time. So it's gonna be after around half an hour. So we can just go and click within 30 minutes here. So you can see PT and INR is normal. Continue. This is the CT scan chest, no significant abnormalities. So this is early stage renal cancer. So now we can order surgery consult and oncology consult to see what their recommendations to further manage the case. So let's type urology consult and oncology consult. They will ask for the reason for this consult, and we will type renal cell carcinoma. The same for the oncology consult, and we will type renal cell carcinoma. And now we can advance the clock to see their recommendations. The consult from urology did not give us specific recommendations, and they asked us to continue with our management. Let's see what the oncology recommendations are. Is the same. So since the oncology consult and urology consult did not give us specific recommendations, we can go ahead and order what we think is best for this case. Since the patient is having early stage renal cancer, we prepared the patient for surgery. Now we can go ahead and order the preoperative antibiotics and order the nephrectomy for this case. So the preoperative antibiotic is going to be cefazolin, and we can type nephrectomy here. Confirm orders, cefazolin, 1 time intravenous, and the nephrectomy stat. And we can advance the clock to see the results of the nephrectomy. The patient will be scheduled for surgery. Please continue with the medical management. So we continue advancing the clock. Now we're starting to get the results of the orders we made. PTT is normal. We continue advancing the clock. This is the results of the nephrectomy. Here is the impression. This is the main thing that you need to read. Evidence of right renal carcinoma, status post-radical right nephrectomy. So the surgery was successful. And now we continue observing the patient in the hospital to see how the case will progress. To monitor the patient, we order frequent physical examinations and interval history follow-up. So we click on interval, general, maybe chest, heart, abdomen, genitalia. We can do that every 12 or 24 hours. And you can see here the patient hopes that the surgery will cure his condition. No apparent distress and nothing abnormal on these physical examinations. Since the surgery is over, we can cancel the nothing by mouth and advanced diet. And now we go ahead and advance the clock for 12 hours or 24 hours while we continue to order vital signs, interval history, and physical examination. So we click OK, and now we're getting the vital signs, nothing abnormal here. We continue, and they're asking us to schedule an appointment. We click OK. Here are the vital signs. If you remember from this case, the patient used to smoke and drink alcohol, so we can make sure of that from here by going to the progress notes, initial history. You can see that the patient has been smoking, so we can consult the patient regarding smoking, no alcohol, to optimize the treatment of his case. No smoking, no alcohol. So we can confirm orders. And now we can advance the clock for another 12 hours and see how the patient progresses. The patient is consulted, continue. The patient is consulted regarding alcohol, continue. And the patient has arrived for the appointment. So the patient was discharged home and came back for his appointment. So here you can see normal vital signs. We can either choose to discharge the patient home if we see that the patient is stable in the hospital after surgery for a day or two, Or you can, as we saw in this case, they asked us to schedule an appointment and the patient was discharged and came back to the office. When the patient is back in the office, you can order interval history, general examination, chest, heart, abdomen, genitalia, okay. And you can see that the patient hopes this surgery will cure his case. So nothing changed from last time. And we can schedule another appointment in a week or two to see if there is anything happening. So schedule appointment, maybe in 2 weeks, confirm move. And the case ended. Now we have 2 minutes of real time to put our case end orders. Here, if you put an order in, the software will not react. You will not see if the patient is improving or not. So it's not as valuable as putting it in the 18 minutes of the simulated case, but it's better than not mentioning it at all. So if you forgot something during the 18 minutes, this is the time to include it during these 2 minutes. Also, if you want to cancel one of your previous orders, you can do that during these 2 minutes. So for us, in this case, we don't have anything to add. So we just click on OK and exit case. And the primary diagnosis is renal cell carcinoma. And we click OK, end of case. So if you want to have a look at the explanation of this case, we go to case 29 and click on explanation, and you'll see the approach to the case. So they will give you a summary of the patient presentation, the physical examination finding, the orders that you should put, what are the results, how you should approach the case in summary. And here are the different routes you can take based on the case. For the clock management, this is the order in which you should put your diagnostics, your treatment options, your surgery. So this is the most helpful part of this explanation. The scoring would tell you what areas of your management would be the most effective, which are things that if you ordered, it wouldn't hurt, it wouldn't be helpful, and the things that you should avoid ordering. For example, in this case, it's saying that renal biopsy would be harmful, so you should not order renal biopsy. Cystoscopy would not be helpful, but it wouldn't be harmful. The same for abdominal ultrasound, chest x-ray. For the therapy, it's saying here that it would be harmful not to order nephrectomy. So you have to order nephrectomy to get the full score of this case. And for the location, it would not be optimal to manage the patient in the ICU. The patient should be managed in the office, then home, then either in the emergency department or the ward. And this concludes the second CCS case of this video. Well, that brings us to the end of this video. I hope that this tutorial on how to approach the CCS cases will help you better prepare for the Step 3 exam. If you found any value in this video, make sure to hit the like button and subscribe to the channel and hit on the bell sign so you get notified whenever I post future videos about the USMLE journey, the residency experiences, and research. Now, in order to enter this contest for the 3-month subscription of the UWorld Step 3 Question Bank and my Step 3 CCS course, first, subscribe to the channel. Second, add in the comments below the name of your medical school, because this contest is only for those who are medical students or graduate medical students. So add the name of your medical school in addition to a topic that you found challenging across your medical journey. Because YouTube does not have a platform for me to message you if you are the winner of this contest, please add your email or Instagram account so I can message you if you were the winner of this giveaway. I will announce the winner of this contest on June 19th at 7 p.m. Eastern Time on my Instagram account at Malki Asad. I will also mention the name of the winner in a pinned comment in this video. So subscribe to the channel, add in the comments below the name of your medical school and the topic that you found challenging throughout your medical journey, and don't forget a way for me to contact you, either your email or your Instagram account if you were the winner of this contest. I want to point out that this contest is not sponsored by YouTube and I'm solely responsible for the distribution of this prize. And finally, I want to thank UWorld for giving me the permission to use their question bank for making this video and giving one of you guys free access to their question bank for 3 months. Thank you everyone so much for watching and being members of this YouTube community, and see you in future videos. Peace.